Nitrosamine impurities are the impurities which have very stringent limit. These are potent and these are considered as the carcinogenic impurities and mutagenic impurities. These are of two types mainly, like nitrosamines or small nitrosamine impurities and the nitrosamine drug substance related impurities which have structural similarity with the drug substance. Various ways are there to mitigate the nitrosamine impurity formation in the drug product, and one of them is use of the right excipients. Let's start with the introduction. Nitrosamines were discovered in the 2018 mainly, and lot of products were withdrawn. But it is not like that the impurities were detected only in 2018. The risk of cancer with these impurities is linked in the 1950s, and these are formed through reactions between the nitrosetting agents and the amines. If the API contains secondary amine mainly as a group or functional group, then it is a risky type of molecule, you can say. Found in the ranitidine, nizatidine, metformin, leading to product recalls. Other formulations were also affected, and that's why the scrutiny was there through the regulatory bodies, and they have withdrawn the formulations which were containing higher amount of nitrosamine impurities. So how these impurities are formed? Understanding nitrosamine formation. So it involves the reaction between nitrites and secondary or tertiary amines. And the contributing factors to nitrosamine impurities and NDSRIs are API chemistry, that is functional groups of the API, excipients, solvents, water quantity, water quality, packaging and storage conditions, packaging materials, and environmental conditions as well. Mitigation strategies are like reducing the nitrosamine formation through reducing nitrosetting agents, qualifying new ingredients, incorporating some functional excipients such as nitrite scavengers. So not only in the formulation, but mitigation strategies are to be done for API as well, and also the excipients as well. What is the role of excipients in the nitrosamine mitigation? Excipients can either contribute to or reduce the nitrosamine risk. Sometimes nitrosetting agents may be present in the excipients, which may lead to formation of the nitrosamine impurities. Also, some excipients are there which can reduce the nitrosamine impurity formation. Functional excipients include nitrite scavengers and the low nitrite excipients. If you have the risk of nitrosamine impurities, you can go for the low nitrite excipients. These are generally known as LN grade excipients, that is low nitrite grade excipients. Nitrite scavengers as functional excipients. You can use these some of the excipients to neutralize nitrites to prevent nitrosamine formation. Common scavengers are vitamin C, ascorbic acid, and vitamin E, that is alpha tocopherol. Some of the studies are done, and they found that these vitamins can reduce the nitrosamine formation. Other materials are also there, like some basifying agents are there which reduce the acidic environment to and get it to neutral or basic, so that the chances of nitrosamine formation can be reduced. Effectiveness of the nitrite scavengers. Ascorbic acid reduces the nitrosamine levels mainly in the direct compression and the wet granulation processes. Higher concentrations can enhance the efficacy, can be used up to 1%. Stress testing of some of the formulations confirms long-term stability benefits. So these materials can be used to have control onto the nitrosamine impurities. Selection of low nitrite excipients. Key to mitigate the nitrosamine risk. Comprehensive nitrite data for excipient is often limited. See, you can ask the API supplier. Many API suppliers are there which can provide you the low nitrite excipients, so that you can have better control on the nitrosamine impurity formation. Binders and fillers preferred for the low nitrite excipients like binders are there, some disintegrants are there, then fillers are there. So mainly if you consider the oral formulations, oral solids, you can have some excipient which are available in the low nitrite grades. Lactose available in directly compressible, spray dried and anhydrous grades. Mannitol is used for the APIs which are sensitive to impurity. Microcrystalline cellulose, MCC and starch are available in the low nitrite content grades. Disintegrants like crosspoidone, sodium starch glycolate, cross-carbylose sodium can be used in the formulation with low nitrite grades. Lubricants and glidants can be used like magnesium stearate is there, tribasic calcium phosphate is there. So excipients can be selected and can have the better control on the nitrosamine impurities. Excipients role in nitrosamine formation. Presence of nitrites or nitrates in trace level may impact impurity formation. These are available in some of the excipients like MCC, crosspoidone, copoidone, povidone, and some other materials. Secondary amines in the excipients can react under acidic conditions. Manufacturing and storage factors like heat, moisture, pH, long-term storage, improper storage conditions can lead to nitrosamine formation. Regulatory oversight, FDA, EMA, WHO require risk assessment for excipients as well. And if you are using low nitrite grade excipients, then you should have justification that the low nitrite grade excipients can have better control. Stringent nitrosamine testing in the API excipients and the final products are required by the regulatory authorities. Now see the key considerations for implementation. Mitigation strategy should be implemented with selecting excipients of appropriate purity and grade, optimizing the manufacturing methods to prevent nitrosamine formation, avoid high temperatures, high pH conditions, high acidic pH conditions in the manufacturing, evaluating impurity interactions for the stability, managing discoloration risk with ascorbic acid, light humidity and pH effect. You might be knowing that sometimes the use of ascorbic acid and use of some other materials like specifying agents can make the formulation with discoloration. So that risk we have to evaluate and mitigate. In conclusion, acceptable nitrosamine limits may evolve with safety data. Selecting low nitrate excipients and using nitrate scavengers are key strategies. If you know that the product or formulation is sensitive for the nitrosamine and NDSRI formation or for the risk of nitrosamine impurities, then you can select low nitrite grade excipients. You can have control on the manufacturing process and you can also use nitrate scavenging agents. Some antioxidants are also there like propyl gallate which can reduce the nitrosamine formation. Many of the times the formulations are required to be reformulated because of the nitrosamine impurities. I will cover this topic in upcoming videos, and also I request you to watch many of the videos available on this channel regarding the nitrosamine impurities. So continuous formulation improvements are required to ensure compliance with the regulatory authorities and also for the patient safety, because nitrosamine impurities are considered as cohort of concern and these have potential mutagenic and carcinogenic effects. Thank you for watching the video.